The Flint Water Crisis by Matthew Hossain for Class HSC 6506 Epidemiology, Professor Dr. Dolores James. Table of Contents. Today we'll be going over the introduction, the historical overview of the Flint water crisis, the impact and effects on the Flint community, government response to the Flint water crisis, lessons learned from the crisis, the aftermath of the Flint water crisis, and then we will conclude with questions. Introduction: The Flint Water Crisis. The Flint water crisis is a current public health crisis affecting the water source supplying the city of Flint, Michigan. More than 100,000 residents of the Flint community were exposed to the elevated levels of lead in the city's water supply. The crisis led to a federal state of emergency being declared with authorized assistance from the Federal Emergency Management Agency and the Department of Homeland Security. Historical overview of the Flint water crisis. In 1987, the city of Flint passed a local ordinance requiring all water main connections to be made from lead pipes. In 1967, the city began purchasing wholesale treated water from the Detroit Water and Sewers Department, which used Lake Huron as its main water source. This change was due to the poor quality of water from the Flint River and the need to provide sufficient quantities of water for the growing population at the time. After the switch back to the Flint River being the main water source, the Michigan Department of Environmental Quality made the decision to not immediately provide corrosion control treatments, which led to the contamination of the Flint water supply. The highly corrosive water from the Flint River ultimately eroded the passivation layer of the pipes, which released contaminants such as iron, lead, and copper into the city's drinking water supply. The Flint water crisis impact and effects on the community. In April 2014, residents of the Flint community began to complain about the changes to the water supply, noting changes in appearance, odor, and taste. This led to a boil water advisory being sent to residents in August 2014 after detection of E. coli in the water supply. In October 2014, General Motors ceased the use of Flint water at its factory due to the water corroding the auto parts. And in February 2015, the Environmental Protection Agency was alerted to the water samplings showing high levels of lead within Flint homes. Residents of the Flint community had substantial suffering due to the lead-tainted water supply, with many reporting that they're feeling ill, skin rashes, hair loss, intellectual issues, gastrointestinal issues, etc. However, the most affected residents were the socioeconomically disadvantaged neighborhoods and the community's children. In September 2015, a local pediatrician named Dr. Mona Hanna-Attisha led a research team and independently evaluated the lead levels from children in the Flint community. Dr. Hanna-Attisha's research and report played a major role in exposing the elevated lead levels and brought the Flint water crisis to national and global attention. Dr. Hanna-Attisha's findings were later published in the American Journal of Public Health and confirmed in the Morbidity and Mortality Weekly Report. Incidence of the elevated blood levels increased from 2.4% to 4.9% after the switch in the water source. Many of the lower socioeconomic neighborhoods with the highest water lead levels experienced a 6.6% increase, with no significant change being seen anywhere outside of the city. The most affected residents of the Flint water crisis were the children and pregnant mothers, where childhood poverty ranks towards the worst in the state, with 42% in Flint being under poverty, whereas the 16.2% of the state of Michigan being in poverty, and 14.8% in the U.S. Dr. Hanna-Attisha highlighted in her report that children can absorb 40 to 50% of an oral dose of water-soluble lead compared to just 3 to 10% for adults. In describing this to the New York Times, she stated, "To understand the contamination of the city, think about drinking water through a straw coated in lead. As you sip, lead particles flake off into the water and are ingested. Flint's children have been drinking water through lead-coated straws." Dr. Hannah Atisha highlighted in her report and showed this graph that shows more children with elevated lead levels after the water change. As you can see in the chart, before the switch, children in Flint were experiencing lead at a 2.1%, whereas after the switch, it jumped up to 4%. Flint children in areas with high water lead levels jumped to as high as 6.3%, whereas Flint children in other areas were back down to 2.4%. And then children outside of Flint in Genesee County were at 1% after the Flint water switch. The report also highlighted the demographic comparison of the time periods before and after the water source change. As you can see from the chart, outside of the Flint community, there wasn't too much of a change after the switch. However, after the switch to the Flint River, you can see that the most affected communities were the African American community as well as the socioeconomic disadvantaged neighborhoods within the Flint community. Many of the residents of the Flint community had to rely on donations of bottled water once the water crisis began to gain global attention. The Flint water crisis also led to an outbreak of Legionnaire's disease, which happened to kill 12 people and affected 87 more. Government response to the Flint water crisis. Government response from the local, state, and federal level were slow to react to the water crisis in Flint, with a state of emergency being declared by President Obama on January 16, 2016, almost 18 months after the water source switch. This led to the Centers for Disease Control and Prevention, the CDC, to deploy a Community Assessment for Public Health Emergency Response, also known as CASPR, which is used to address the impact of the water crisis within the Flint community. The response from the CDC and the Agency for Toxic Substances and Disease Registry worked with the city and state officials to develop a response and recovery plan, which led to coordinating effective health messaging, assessing lead exposure in the community, providing guidance on blood lead screening protocols, and identifying and linking community members to educational, social, and environmental follow-up services. Lessons learned from the Flint water crisis. In July 2018, the U.S. Environmental Protection Agency Office of Inspector General released a report citing that implementation and oversight lapses at various levels led to the Flint water crisis. The Environmental Protection Agency, the State of Michigan, the Michigan Department of Environmental Quality, as well as the City of Flint were all held responsible. Failure to properly implement the lead and copper rule under the Safe Drinking Water Act. The EPA OIG report recommended that the EPA headquarters and EPA Region 5 use the lessons learned from Flint to improve its oversight of Safe Drinking Water Act compliance. Recommendations also include a revision to the lead and copper rule to improve the effectiveness of monitoring requirements. 8 of the 9 recommended action plans the report mentioned has been implemented to date. Aftermath of the Flint water crisis. In the aftermath of the Flint water crisis, thousands of residents have filed lawsuits against the state in efforts to receive compensation for the damage and suffering caused by the mishandling of the crisis. A multi-year project was created to replace the lead service lines in Flint residents' homes with an $87 million settlement with the state of Michigan. This effort was supposed to be completed by January 2020. However, efforts were halted due to the COVID-19 pandemic. The failures and mishandling of the Flint water crisis led to criminal cases being brought against government officials who were implicated in the crisis scandal and cover-up. However, Attorney General Dana Nessel announced that her office was dropping any pending criminal cases against these officials, pledging to continue the investigations. As of September 2020, no additional charges has been filed. In August of 2020, the state of Michigan is expected to pay about $600 million to the victims of the Flint water crisis, pending approval from the federal judge in Michigan, according to the New York Times. Tens of thousands of Flint residents are expected to be eligible to receive money under the settlement, with 80% allotted to the exposed children of the Flint community. Aftermath of the Flint water crisis. Currently, the Flint water crisis is still a crisis. Many of the city's residents are still feeling the effects of the exposed levels of lead within their drinking water supply. Actions from the city, state, and federal level has all helped to mitigate these effects by introducing programs and resources that the city's residents can access, as well as providing a settlement for the city's residents that were exposed the most to the Flint water crisis. Questions. Please provide any questions below in the discussion.